Welcome to our educational video on bladder hypoplasia, a rare condition affecting the urinary system. We'll explore what it is, its causes, how it affects the body, and the available treatment options. Join us as we delve into this complex condition to gain a better understanding. The exact cause of bladder hypoplasia is not always clear, but it's generally considered to be a congenital condition, meaning it's present at birth. This suggests that it arises during the development of the fetus in the womb. Genetic factors or disruptions during organogenesis, the process of organ formation, may play a role. Exposure to certain substances or infections during pregnancy might also contribute, though more research is needed to confirm these links. Bladder hypoplasia results in an abnormally small bladder. Because of its reduced size, the bladder has limited capacity to store urine. This leads to frequent urination and can prevent the bladder from emptying completely. The constant incomplete emptying increases the risk of urinary tract infections. The increased pressure within the urinary system, due to the bladder's inability to adequately store urine, can also potentially damage the kidneys over time. Bladder hypoplasia is a relatively rare condition. Due to its rarity, precise epidemiological data is limited, and its exact prevalence is not well established. It's observed more frequently in association with other congenital abnormalities of the urinary tract, making it difficult to isolate the incidence of bladder hypoplasia alone. The most prominent symptom of bladder hypoplasia is frequent urination, often both during the day and at night, known as diurnal and nocturnal frequency. Children with this condition may experience urinary incontinence or bedwetting. Due to incomplete bladder emptying, they are prone to recurrent urinary tract infections, which can cause pain or burning during urination, and sometimes fever. In severe cases, if untreated, the backflow of urine can lead to kidney damage, which may manifest as flank pain or high blood pressure. Diagnosis of bladder hypoplasia typically involves a combination of clinical evaluation and imaging studies. A detailed medical history, including voiding patterns and any associated symptoms, is crucial. Ultrasound imaging can help assess the size and shape of the bladder. A voiding cystoarthrogram or VCUG is a specific X-ray taken while the bladder is filled and emptied, can reveal the bladder's capacity and any reflux of urine back into the ureters. In some cases, cystoscopy, a procedure involving inserting a small camera into the bladder, may be used to directly visualize the bladder's lining and confirm the diagnosis. Aerodynamic studies, which measure bladder pressure and function during filling and emptying, provide valuable information on bladder capacity and efficiency. While bladder hypoplasia is primarily a single entity defined by reduced bladder size, it can present with varying degrees of severity. Some classifications focus on whether the condition occurs in isolation or in conjunction with other urinary tract abnormalities, such as urethral obstruction or vesicoureteral reflux. Treatment for bladder hypoplasia focuses on managing symptoms and preventing complications. Behavioral therapy, including timed voiding and bladder training, can help improve bladder control. Medications, such as anticholinergics, may be prescribed to relax the bladder muscles and reduce urinary frequency. If recurrent urinary tract infections are a problem, prophylactic antibiotics may be recommended. In severe cases, surgical interventions, like bladder augmentation, which involves increasing the bladder's size using a section of the intestine, may be considered. The choice of treatment depends on the severity of the condition and the individual's response to various therapies. As bladder hypoplasia is primarily a congenital condition, there are currently no known methods for preventing it directly. However, optimizing prenatal care, including avoiding harmful substances and managing underlying medical conditions during pregnancy, may contribute to overall fetal health and potentially reduce the risk of congenital anomalies. The prognosis for individuals with bladder hypoplasia varies, depending on the severity of the condition and the presence of associated abnormalities. With appropriate management, many individuals can lead relatively normal lives. Recent research is exploring potential genetic markers for congenital urinary tract defects, including bladder hypoplasia, which may lead to improved diagnostic and preventative strategies in the future. Investigating novel surgical techniques for bladder reconstruction and exploring the role of regenerative medicine in bladder development hold promise for improving outcomes in severe cases.